So I'm looking at my colleagues. I have a question that Anna wants me to ask. So Professor Anna Mastriani is also a member of the committee, as I think we introduced ourselves earlier. Nick, FYI, but I think you knew that anyway. I'm going to ask a question on her behalf. Anybody else want to be on the list? Jeff Botkin, we'll start there. So Anna asks of Nick, the environment in which IVF was developed was unregulated. Can you tell us anything about the consent practices employed by Steptoe and Edwards at the time, one, and second, how many women and or cycles it took before they achieved one live birth?
This is something that has been investigated by my colleagues Martin Johnson and Kay Elder, and will be reported in the papers that are due to be published in the new journal Reproductive Biomedicine and Society Online this summer. So I don't think that's something that I should say very much about.
Okay, we're hanging on the answer, but you're telling us to stay tuned.
Well, that work will be published during the lifetime of the committee. I mean, I gave a sense that there was they think some ethical oversight. It is known that they used some kind of the volunteers signed material, but I think that's something that should wait for that work to be published.
Okay, Jeff.
My question is also for you, Nick. This is Jeff Botkin on the committee. You mentioned that safety concerns were sort of paramount for some of the very early discussions around IVF. I wonder if you could just comment on the evolution of that set of issues with the development of the technology. Did the birth of a healthy baby, did that have a profound influence on the safety debate, or what's the arc of that debate with IVF?
The safety concerns are initially coming out of existing concerns about laparoscopy, which was quite controversial among some senior British gynecologists, and of which Steptoe was the British pioneer. So that was a matter of quite a lot of concern to the referees. As time goes on, and it's clear that many women have been through these procedures. You know, and we're talking about many dozens, and that is, I guess, a partial answer to Anna Mastriani's question. That becomes less of a concern, though it is tabled quite importantly by feminist critics of the technology, especially FinRage, by the mid-1980s. So that concern is there, but I mean, as Dr. Almerling indicated, really a great deal more emphasis has been on the risks to potential children. And so early committees were keen in the UK, for example, that a register should be kept of every case and long-term studies done. That wasn't set up. But as far as I know, there's been much less attention, much less concern as this began to be routinized about the safety, certainly in the way that it was expressed in those very early days.
I've got Alta, and then looks like Alan.
Thank you both. Very interesting. Question was for Renee. You started by pointing out that this field developed, as you put it, in a laissez-faire fashion in the United States. You specifically mentioned who can use it or why can you use it, being things that were not being regulated. To the extent that it was being treated as a service and not as a regulated product, you know, like a drug, or in what way was that different from the way medicine is generally regulated in the United States? I don't remember many examples of federal regulation of who can use, or why can use a medical service.
Yeah, it's a great question, and I think that, gamete donation has been so interesting to study as a sociologist because it falls in between sort of medicine and service provision. So a number of the sperm banks that were founded in the 70s were for-profit companies, and so they were selling services, and yet they were often run by people with PhDs or MDs, and so they were providing a medical service. They often used the language of medical service provision. So one of the sperm bank founders I interviewed said that they characterized or they considered sperm a well-characterized material for use by a physician, and they would only, and it's common for sperm banks only to send it to physicians. And so in the early days, it was this medical service that they were trying to draw on medicine to gain legitimacy for sperm donation, but at the same time, it was a service. And I think another important part of this history is that when you leave it in the hands of individual businesses, then they can often feel quite free to discriminate. And so the last national study of the number of children born from sperm donation was done in 1988 by the now defunct Office of Technology Assessment.
I was the study director.
Oh, voila. Great. You are not defunct.
Only congressionally funded for California sperm banks ever on record.
Right. Yeah, so then you know better than I do that in that study, 60% of the physicians surveyed about who provided sperm donation to their patients said that they would not provide it to lesbians or single women. And so part of the question here, I think, is also not only who's going to have access to it in terms of financial resources, but how do our larger inequalities around race and class and sexuality in terms of discrimination that, is not really that far distant in our history. How are those going to play out with yet another reproductive technology?
Thanks. I'm still a little confused how it differs from fertility care in general that doctors would or would not have provided, but I know that time is limited, so maybe offline we can talk a little further.
Mm-hmm.
Great. Alan, please.
Okay, well, just one statement. IVF is the only medical procedure that has a federally mandated registry, so there is some oversight. But my question, the thing I'm interested in is about egg donors, in that not being parents, because with sperm donors, of course, there is a movement to search out, for children to search out their sperm donor parent. Now, egg donation has been around long enough that these kids are old enough to want to do that. Do you think that's the difference, that children are not looking who their egg donor was, where they're more likely to look to who their sperm donor was?
Yeah, actually, as I was putting together my remarks for today, this occurred to me as a next sociological study that could be done. So there's a number of websites. Donor Sibling Registry is the best known one, and there are egg donors and sperm donors and children of sperm donors and children of egg donors who have all signed up with that registry. But that would be a first pass at your answer: is there a difference between the number of people searching out a sperm donor versus the number of people searching out an egg donor?
But you must have a theory why it's so different.
Well, I think the idea of patrilineal lineage looms large, and so another difference is that sperm banks have set in place identity release programs. So they have formal programs where men can agree to be contacted at the age of 18. Egg agencies do not have identity release programs. Is that because they think the children won't care as much? Is it because there's other ways of, so there are these differences in how we think about motherhood and fatherhood that infuse this market in important ways. And I'll just say one brief comment so the CDC does have this ART report that they collect, but importantly, they conflate egg donation and embryo donation. So when they report out how many egg donations are happening, they've got together people who are donating fresh eggs, people who are donating leftover frozen eggs, people who are donating embryos. So there's actually, and they're not collecting data on short-term risks or long-term risks. So it's
really just a demographic registry. It's not even an epidemiologic.
Exactly, right.
So I want to ask the last question, and this is actually from Keith Whaley, who would be sitting there. He's on his way, so he's doing this en route. For both of you, could Nick elaborate on the case-by-case approach to MRT approval in the UK, especially as in contrast to Renee's characterization of the U.S. more laissez-faire, market-friendly approach to IVF and other reproductive technologies. What ethical and social considerations or regulatory concerns are behind the UK's approach?
I mean, this is something where I think the best thing you could do would be to look at the website of the HFEA, where you'll see that a whole series of new technologies has been approached in this way. Case by case here would mean that it would be individual licenses and the condition of close monitoring and follow-up and so on. So I suppose it's follow-up, it's licensing of people and premises in the way that the authority does in general, with even closer oversight for this.
Can I just add a small comment to that? I mean,
Sure.
I think if we looked even beyond the US and the UK, there are really significant national differences that are tied to national histories. So, for example, in Germany, there's quite a lot of regulation against assisted reproduction because of the history of eugenics. The Catholic Church in Spain has had an outsized role in these technologies there. And then in the United States, we have an ethic of individualism and an ethic of, the market knows best. And so I think it's not a surprise that different countries have taken different tacks. And I think to the extent that we can learn from the effects of how it's been regulated in other places, that can be helpful.
Thank you both. And Nick, we'd love you to stay for as long as you can, but I know it's late in the day there, so we'll have some conversation in the course of the remaining time. So if you can stay on, that would be wonderful. Stay where you are, Renee, if you don't mind, just so you can see the slides, but we're going to ask people to stay and converse as we go. So.